Hi, this is Kim McAllister, and today we're going to talk about the evolving e-patient. We're going to talk about e-patients because I think that we've spent a good bit of time talking about e-health or health informatics, electronic health records. We've kind of talked about the the ways that we use informatics and how all of that impacts patient care, but we haven't really examined what the patient looks like. What is the patient experience like? What kind of patients are accessing and using informatics from from their end? We've looked at how it plays out in the hospital and what we as healthcare workers use it for, but we haven't really looked at what patients expect from it and access it from. So this is why we want to focus on that this chapter. Um, E-patients are people that connect to a vast array of digital health services and information. This can be things like chat rooms, social media. There are social media healthcare sites out there. It could include support groups. It could include groups for patients with chronic conditions, mobile devices. It can also include sensors such as a Fitbit or other type of electronic watch. Um, and then it can also go to devices such as a cardiac event monitor or an apnea monitor. Also, health insurance sites. Most health insurance sites now have portals for patients who are members of their organization. And patients can get on there and view claims and find out about kind of what the status is on certain claims, but they can do more than that. They can also participate in health activities. It may have a place for them to upload information or link information from their doctor's office. And participating in some of these activities can even lead to a reduction in deductibles or monthly payments for health care. So they can be very helpful. Also, patients can get on there and find providers who are covered under their insurance and DME providers and pharmacies and other things. So they can actually use these sites to navigate quite a bit with their health care. E-patients are active partners with their healthcare providers. They're not trying to drive their healthcare by themselves. They're seeking to interact with their provider and be a part of the team. There are certain technological and legislative influences that we're going to talk about in just a minute, but what I want to do first is kind of look back on where the whole concept of e-patient came from. And we have found that as early as the 1960s, we first started seeing computers being used to conduct medical interviews. In 1975, the term e-patient was first coined by a physician, Dr. Thomas Ferguson. By the end of the 90s, e-health became a common term, although there's not a unified definition of what that means. It's kind of a broad concept, but because the internet suddenly became such a powerful tool and so many people began to access and be online, then it became an enormous tool for healthcare. And now we would really define an e-patient as someone who uses technology to actively participate and manage their health and wellness. They're also digitally enabled to both seek out and share health information, and they can also connect with patients who have similar problems. And so it has become more than just a simple tool. It's become something to really help patients handle their health problems and learn how to deal with them and manage them. And we'll look at that a little bit more in just a moment. So technology, the growth and sophistication of the internet had a very significant role, played a key role. Um, it was something that I don't know that many people really imagined would happen, and all of a sudden we could get online and find all of this information. Of course, it was very slow at first, but as it sped up and as we began to see things like Google and WebMD and other health information sites, it really took off. So by 2012, 2.3 billion people worldwide. There's a little more than 8 billion people in the world, so that's a significant portion of the population. And there are 8 new users every second. The drawback to this has been that we have had some problems. You hear all along about different health insurance or different health organizations, hospitals, other clinics having their information hacked and patients' information released. We have had instances where patients have had their medical devices hacked online and they've been held ransom. They've had their health information and health records held ransom. So we have some flaws that we have to work on. So patients have certain expectations about their health care, and their health care has to be more than just a patient visit. It's got to be something that is helping them deal with their problems each day. Their health care has to be individualized to them. We have to have the patient as an active part of the healthcare team, and they have to be involved in deciding how their healthcare is going to go so that their healthcare maximizes their issues and makes their life livable for them. They need to have a certain amount of control over their health care, which is something that patients still really don't have. We can make requests and say this is what we want, or we can refuse care, or we can ask for treatment, but we aren't the final say-so. That comes from, really it comes from the health insurance company as to what they're going to cover, and it comes from the providers who decide what kind of care that you're going to receive. Information. There is all kinds of information out there. I think we can all agree on that. Some of that information is helpful. Some of it's not very accurate. You have all kinds of interesting sites that have some very interesting opinions about healthcare and things. And we have to know what those are, and we have to teach our patients how to find credible sources for information. Science. All of what we do should be based on science, safety. We need to keep the data safe. We need to keep our patients safe when they're online. They also need to be able to find out information about how to be safe. So we have to look at safety kind of in a 3D perspective. Transparency. There's a move now where some physicians are putting their patient notes online, and patients are have the ability to access it and can even make changes if that information is correct. And your book talks about an instance where something like that would save a patient's life because someone had been prescribed medication and the patient's allergies were not recorded correctly. And so if the patient had been given that medication that they were allergic to, then they could have died. So we have to have everything transparent so patients can see it and interact it. And as you can imagine, not all providers are very comfortable with that. They worry about lawsuits. They say they can't be as detailed if they can't protect their information from other people looking at it. Healthcare needs to be anticipatory, and we do, from my work with Medicaid, I can tell you that we have tools, we have healthcare IT systems that will look at a patient, and then they can identify some of the potential risk and even have some care parameters that's saying because the patient has these diagnoses, then these are the things that you need to be sure that they're screened for, and so on. So this is something that's very helpful. And value, we want to provide the best possible care at the least possible cost. And by accessing more of the patient's information and finding out more about them and kind of identifying certain potential problems, heading those off, that can all help to contain cost. And then cooperation. Our healthcare needs to cooperate with the patient, with their, both with what they want, with helping them achieve their goals, with helping them understand why certain procedures are ordered or why certain treatments are ordered, and so that the patient can understand what the healthcare team thinks is best for the patient, but also so the healthcare patient can find out from the patient, is that really the patient's goal? Is that really what's best for the patient? So we have online healthcare consumers, and we want to look at what the typical healthcare consumer looks like. We have the well consumer who has very sporadic needs, and they may just be looking for specific information on how to prevent illness and problems. And that's 60% of our users. So we need to be sure that whatever that we are providing provides us a strong set of prevention and health maintenance information for patients. Also, the newly diagnosed, these are patients that will come into eHealth and try to get information to understand and figure out what's going on with me. How bad is this? How much do I need to listen to my healthcare team? And this is about 5% of the users. The remaining 35% of the users are those who are chronically ill. And they will go to sites that are helpful to them, that provide them resources and information and give them support for their conditions. Some sites can even provide patients with samples and information. Think about your diabetes sites like the American Diabetes Association. All of the major insulin manufacturers and manufacturers of glucose testing like Accucheck and One Touch and so forth, they all have really great sites that patients can sign up for, and they can track their disease progress, and it will provide a lot of information for them. So this is something that these patients are seeking. So we have this conversion of e-patient, patient-centered models of care and informatics. A patient-centered model shows that the patient is at the very center of the healthcare, and the patient is a full partner of the healthcare team. And think about how great that sounds, but then think about how seldom that really happens. Are we really in there treating our patient like they're part of the healthcare team? We still see that providers and insurance companies are the main drivers of care, and that's something that needs to change. And we fully expect that the internet and eHealth and Health 3.0 will begin to change that. So this is going to be really exciting to see where this goes in the future. So we had an evolution in healthcare informatics where this basically just began with the electronic health record. Now we also have the ability for patients to put in their personal health information, and we have the ability for patients to actually access their patient visits, their physician notes, their provider notes, and actually to make changes to those. Donald Berwick is the former director of CMS, that's the Center for Medicaid and Medicare Services, and he said that participatory patient care had three maxims. First of all, the need of the patient comes first. Every patient is the only patient, and then we make no decisions about the patient without the patient. That's what nothing about me without me means. And if you Google Donald Berwick, you'll find a lot of information about him. And he has done a lot of work on Health 3.0, which is the next step in e-health. And you'll find some really interesting information if you look at that. We have a new culture and partnership where we have guided discovery, where we are working to help guide patients and help them find information. We also need to update our own information and our own skills. And we need to demonstrate a willingness and understanding to help patients find good sources and get the information that they need. HCAHPS is the first national standard public report of patients' perspectives of their experiences, and you can find some information about that. Patients Like Me is a research-based online platform, and this allows patients to share information and learn from each other. It's also used for people who decide to become research partners with Patients Like Me to pull all of this information that patients provide and use that for research. And you can come on here and look at any type of patient and find out who's near you. You can choose conditions or treatment. Maybe if you're having a specific test, you can put in the test and see. You can select by condition, like if you wanted to look for breast cancer, and it'll show some symptoms, common symptoms, how many people have tried all these different treatments. So it gives some really good information overall to provide patients with information about different treatments. It can help patients make decisions about what to do. And then it talks about different types of treatment. So you can look up different drugs, different treatments such as physical therapy, psychotherapy, so on. And then they have the information about research. Now, we want to provide some guidance to patients about social media. They need to read, first of all, the conditions of use. And if you go down to the bottom, you should be able to find, like, here's the user agreement. So here's your terms and condition of use. They need to read through this carefully so that they understand what the information, why is this site here? Is this just something to benevolently help people, or is there some other reason? Like in this case, Patients Like Me is also using this information for research. There's a privacy statement, and they have a privacy policy. Obviously, if you have the opportunity to put your own information about your health on here, and clearly you can just click on it, see, and we could see Zoomer. People can have access to your information. So patients need to be very careful and understand who they're sharing their information with. Go to the About Us statement or the About statement to find out exactly who started the company and what they're using it for. And advise patients just to lurk on the site for a while before they decide to sign on and share all about themselves. And they can kind of follow a few patients for a little bit and sort of see what the general attitude and behavior is of people on the site. You don't want to get onto a site where people are interesting. Remind patients to always be kind and polite on these sites, and also to, if they're angry or upset, not to make a post until they calm down. And then you need to kind of evaluate content that's posted by others. They need to remember that in a social media site, advice or recommendations may or may not be given by someone with medical experience, and so they shouldn't just say, oh, this person said to do this, and then go and do it without talking to their provider about it or finding out a little more about it. So that's kind of a cool site. We already talked about how some physicians are on board with sharing their patient notes and everything about the patient on their website. My physician does that. It's really cool. You can go in and download your note, or if you go into another doctor's office and they want to know what did the physician say about this, then you can pull it up and say, well, here's what he said, and that's helpful. There are some concerns by providers about that. Some is that it takes up a lot of time and can make the office visit longer because they've got to finish filling all of that out before the patient leaves, and they can't always be candid in their office notes. The Health 2.0 is the dynamic and interactive part of Web 2.0, where information is harnessed. This is where people can share information and seek out information. This is kind of the current environment, but we're moving into Health 3.0, which we'll talk about in just a minute. And the Patients Like Me is one of those, and then there are a few more that you can look at. So Health 3.0 is going to add the dimension of different devices like your Fitbit and other devices that you may have, maybe genetic testing, that kind of thing. It can all go in. You know, those DNA kits that you do, maybe that could be added. I'm still not sure how I feel about those DNA kits that you send in, because there's no clear decision on what happens to that information. This just kind of shows the patient and the caregiver journey on eHealth. They begin having symptoms, and then they start trying to figure out what is this, and they go on different websites maybe and try to figure out, do I need to see my doctor, do I not? And then actually getting a diagnosis that they agree to, that they believe. Sometimes that takes seeing more than one provider. And then they're at the point where they have to understand what this diagnosis means. What is it going to mean to their life? And then what are we going to do? How am I going to manage it? And then when they get to the point with optimizing and adjusting and living with it, this is where they really will use a lot of the support sites to get information about that. Now, chaotic. This is a picture about chaotic. And chaotic organizations both have chaos and a certain amount of organization. And they don't ever get to a place where they've arrived and everything's okay. And that's why this is in here, because healthcare is chaotic. We do have organization, but we do have chaos. We do not have a lot of the organization and alignment and agreement on how things are to be done between providers and patients and insurance and other entities in healthcare. And so we're in this continual process, and it can be very frustrating. It can also be really great when things start working out, but there are so many people involved, including the government and government agencies and healthcare agencies, and there are our watchdog groups, our quality assurance groups, the Center for Medicaid and Medicare Services. All of these things together create so many different levels of interaction and responsibility that it's very difficult to get those organized. So Web 3.0, as I already said, is going to customize content based on interest and needs, and also adding to it the complexity of adding devices. And Health 3.0 is a part of Web 3.0. So with Web 1.0, we had basically we got on the internet and there was just all this information and nobody could add anything to it. It was sort of just a way of locating all the information that was. Web 2.0 brought us things like wikis where we can get on and add information and contribute information as well as obtain it. And then 3.0 is going to, and you've probably already seen some of this if you've been on certain online sites like Amazon where you've bought certain things and it'll say because you have an interest in this, you might like that. So that's the 3.0. Have you noticed if you've been in grocery stores that certain stores it will pop up on your phone that there's a coupon for this? So that's all part of the Web 3.0. So Help 3.0 will be a part of Web 3.0.